femur. This is your tibia. Interestingly, you have what's called a bipartite patella. You have a little ossicle right here. Pretty common. Not worried about it, but that's what that little thing is.
What does it mean?
It's just a part of your kneecap that just didn't fuse when you were growing.
Oh.
No big deal. I have one of those in my own hip, so it's a normal thing. The other thing is that this is your lateral tibial plateau. This is your medial plateau, so the inside of your leg, the outside of your leg. And what we're seeing here is actually this right here, right there, is your joint that's supposed to be up here. So about 3 centimeters below where it's supposed to be, okay?
What's supposed to be, okay.
And I'll show you that. And this is that piece of bone that got stuck behind your tendon back there.
Oh.
Okay, so this is not supposed to be there, and that was blocked because you had a tendon sitting in here, and that's called the popliteus. And then your meniscus was also torn and sitting in there, and we fixed all that for you, okay? And so, kind of blown apart. This is also fracture, fracture, fracture. Fracture means broken, okay? So a break and a fracture are the same thing. This is that little ossicle you have, no big deal, not overly worried about that. That's your kneecap here, your patella. This is called the bipartite patella, okay? If you look at the other studies here, your CT scan, let me pull up a slightly different view.
So this piece was sitting 3 centimeters. So it really it broke completely off.
Yeah. Yeah, so you kind of blew this up a little bit, like for lack of a scientific word. I mean,
and it's really just the bone, the femur, putting pressure on that.
Right. I don't know why this is kind of acting up for a quick second. Give me 2 seconds. There we go. So 29 millimeters equals 2.9 centimeters. So rounding it up to 3 centimeters, that's more than an inch of depression here, okay? And so this is that lateral joint right there, okay? You also had a small fracture here, but
I see. That's supposed to be up there.
This whole area is supposed to be up here.
Oh, wow.
Okay. And this is a cool image. This is a 3D reconstruction of your fracture.
Oh, wow.
So this whole area of bone was 3 centimeters lower than it needed to be. You had 2 fragments of the lateral cortex over here, 1 and 2. But then this piece of bone was a separate fragment, and your popliteus tendon was sitting right between the fibular head right here, okay? Pretty scary because the perineal nerve wraps around there too, and that's the nerve that provides sensation and function to your foot. So that's why we didn't really want to cut or go back there unless we had to. Basically, we were able to kind of skewer that with some big stout wires, move the popliteus tendon out of the way, and kind of slide that back to where it needed to be, okay? If you look at this other one.
It looks so bloody.
But that's that fragment we had to restore of that posterior lateral corner, which is a little bit of a unique situation.
So the tendons then hold that other bone. I know you have the tibia, and then there's the other. What is that? The smaller bone.
The fibula?
Oh yeah.
Yeah.
But that there wasn't any issues with that one, huh?
No, the smaller bone was fine.
It kind of looks like a
So during surgery, basically what we did was we restored your joint. Remember, sitting down here, I popped that back up to where it's supposed to be, so it's right here, okay? And then we filled this with bone graft. You got a lot of bone graft because when that bone kind of piles drives itself into the tibia, it kind of smashes all the bone. And when we pull the cartilage back up to where it needs to be, then you just have a big pocket of air that won't heal, and so we had to pack it with bone graft that acts as a scaffold to allow it to all incorporate. But your medial joint's perfect, totally not involved. Your lateral joint now looks healthy, or at least restored. You have a lot of cartilage damage over there, unfortunately, because of the nature of this fracture, but the most important thing that predicts long-term outcomes is restoration of the joint line, which we did. And your meniscus was nice and robust and healthy, but it just tore off of its base attachment, so we just sutured that back in through the plate. If you look at the outside here, you have some screws that go anterior to posterior to capture that piece. There's still a little bit of step off there in this one view. That's very minimal, and on this view, it's perfect. So That'll all heal for you, okay?
Oh, wow.
And then your post-ops look good. Your medial joint, the inside, the outside, plate. You got 4 screws running underneath here. 5, 6, 7, 8, 9. So you got 9 screws total, and it looks good.
Wow.
Looks good, man.
Wow.
So long story short is that I think you're gonna do fine. Definitely kind of a gnarly injury, but at the end of the day, I think that's as good as anyone can make it look. So, okay?
Nice job.
Thank you.
All right. So long story short is you gotta stay on crutches for 2 months. We're not gonna
Okay.
let you walk on it for 2 months. We're gonna keep you limited on range of motion for at least 2 weeks, and then slowly advance your range of motion in about 2 weeks when I see you back in clinic. Okay?
Perfect.
Wait,